Hi, I'm Darlene. So as most of you know, we come down here for a few months every winter to get away from the cold Canadian winters. And this year I've decided to check into getting my cataract eye surgery done while I'm down here. Why would I do that, you ask? I'll start off by giving you way too much information. I have cataracts in both eyes. I have astigmatism. I'm near and farsighted. On top of that, I had a hemorrhage in my eye about 20 years ago that caused me to lose the sight, the central vision in my right eye. So in my right eye, I'm legally blind. I have no central vision, but I do have peripheral vision. So about 3 years ago, I checked into getting the cataract surgery and getting enhanced lenses put in as well. So I went to the appointments and it ends up that they won't do it either. The main reason is my cataracts aren't bad enough yet to qualify for cataract surgery. So their advice at that time was, wait another 3 or 5 years and come back and we'll see about doing it then. But again, they won't do it now, and they quoted me a price of $6,500, and that was 3 years ago. So before coming down here, I did a lot of research online and I contacted Perfect Vision in Cancun. When I got here, I called them and I set up an appointment to come in for a consultation. So on the first visit, we went there. We took a bus into Cancun and just walked a 15-minute walk from the ADO bus station. And the building is nice and bright and clean, very modern equipment inside. I then met with Dr. Arturo Castellanos Bracamontes, and if I butchered your name, I'm so sorry. I tried. He speaks English very well, so it was very easy to converse with him, ask questions, get my point of view across, and understand what he was recommending and saying to me as well. You can find lots of information on their website. All the information and credentials of the doctors are listed here. So on the first visit, you're going in to have your eyes examined, get eye measurements, talk to the doctor about what his recommendations are for the best outcome or what options are best suited for your particular situation, and of course get the pricing as well. After talking to him and discussing my issues, we have decided to go ahead with the surgery. We will have a monofocal single vision lens in the right eye, nothing more than that because it won't make any difference. The left eye is going to have a multifocal lens put in, which will give me far range distance, mid range distance. I will still need glasses to read, which 100% okay with that. That if I can get back part of it, I'm totally thrilled with that. The cost for this is going to be 30,000 pesos for the right eye, 70,000 peso for the left eye. A better lens, a lot more money. So the total is 105,000 pesos, which transfers equals to $6,915 Canadian. So it's about the same price as what I would pay at home, but they won't do it for me at home. So we're gonna get it done here. The other good thing about getting it done here is they do both eyes at the same time. So I'll be blind as a bat for 24 hours, hopefully better after that. In Canada, they only do one at a time. So you do one, and then a month later, you do the other one. And there is some things you have to do pre-surgery, so post-op. You have to get an EKG. You have to go for blood test and urine test. And then you have to go and buy, there's 3 prescription eye drops that you need. I think it's a steroid, antibiotic, and tears that you're going to need as soon as you come out of surgery. Oh, and you do have to pay for the EKG, the blood work, urine test, and the prescriptions separately from the cost of the eye surgery. Fingers crossed! So pre-surgery, I needed to have some tests done. One thing was an electrocardiogram. So we went to Costamed Hospital first, and then we came here. So Medica, Puerto Morelos, it's just down the street from the Costa Med Hospital for the electrocardiogram, was 500 pesos for the test. Or you could come to the Costa Med Hospital and have it done here for $119 US. Ridiculous price. This is where I came for my blood work. Cost 750 pesos. Very nice, clean place. The ladies in there were very friendly and did a good job. It's just down the street from Cataract.
Hola, ¿qué tal?
Hola.
Sugería, esta niña tiene unos lentes azul, se nos salieron a la base, el lente del lado derecho, el lente del lado derecho y acá Hola, darling. What are you doing today?
Today I'm having my cataract surgery.
In Vienna?
In Cancun at Perfect Vision. So they just put the eye drops in my eye that will dilate my pupils and get me all ready, and then they're going to give me a happy pill. Marty wants one too, but nope, only me.
Hola.
Okay, so it's the day after the surgery. The surgery itself was not too bad. You don't feel any pain or anything. You feel a little bit of pressure, and as they're flushing liquids and fluids over your eyes, it's running down your neck. Marty says I was in there for about 50 minutes, 50 minutes, doing 2 eyes. As soon as you're done, they take you out of the room and hand you over to your person and say, see you tomorrow. So they give you sunglasses to wear. Your eyes are very light sensitive. My eyes were so light sensitive. Once I got in the taxi, I just kept my eyes closed the whole way home. We came home and I just went to bed and put my headphones in with my music, because you can't read, you can't watch TV, you can't do anything. And you are kind of drowsy from the pill that they give you. It's kind of like an Ativan, but a different brand. So yeah, I just slept the afternoon away. No pain, a little bit of scratchiness. And then you start your eye drops. One of the eye drops burns and the other 2 do not. One thing I read that the doctor's office didn't tell me is you have to wait at least a minute between applying different eye drops. Your eye can only absorb an eye drop every minute. If you do it sooner than that, the second eye drop's just gonna wash the first eye drop away. So yeah, just go home, relax, do nothing. I woke up this morning hoping to see better, and that's not the case. My right eye, the peripheral does seem better. I can see fingers and everything. But this eye, which was my good eye, not so good. It's very blurry, almost like when you're crying, your eyes go all blurry. That's kind of what I'm seeing. So if I look at Marty, he has no head. If I look over at the fridge, I know where the fridge is, but it's just kind of, I can't make out images yet on that eye. So we're headed back to the doctor this morning for my second appointment at 11:30. Hopefully it will continue to improve over the day. Marty's research says 24 to 48 hours. is when your eye gets as good as it's gonna get. So I'm a little worried, but I'll fill you in later. Okay. So we went to the doctor's office today and they said I have a small edema behind my left eye. That's why I'm having problems focusing and feel like I'm underwater. So they froze it and stuck needles in my eye and withdrew some of the fluid. Right away I could see a little bit better, and they said it's just a normal thing. There's just, the body didn't absorb the fluid as quickly as some other people do, so nothing to be worried about. Give it 2 or 3 days and everything should be fine. I have another appointment to go and see them again in about 5 days. Okay, so it's the next morning. I'm not seeing any better and I'm not happy. Marty can tell. So it appears that my left eye is still seeing everything all cloudy and foggy. My right eye, which has the hole in central vision, has become my dominant eye, so whatever I look at just disappears. It's a hole. So to see anything, I have to look all the way around it using my peripheral vision to see anything. Yeah. Okay, today is Sunday. Surgery was Thursday, so Thursday, Friday, Saturday, Sunday. So day 3 after the surgery. Last night I noticed a little bit of improvement in my eye that's all wonky. Up until last night, anything I looked at just disappeared. It ended up in the big black hole that I see from this eye. This eye was becoming the dominant eye and everything I looked at just disappeared. So if I was walking down the sidewalk, I couldn't tell if there was people coming towards me or cars coming towards me or anything. So it was really difficult to even walk. Last night I noticed an improvement. So I woke up feeling better this morning. So there is some improvement from yesterday morning. So we'll just carry on and hope it improves some more. Yesterday, it got to the point where we ended up calling the doctor because I was pretty concerned about it. And he just reassured me and said, I told you it was going to take a couple days after I saw you last time. Just be patient, use the eye drops, do what you're supposed to do. And then he did say I could come in on Monday anytime and he'd squeeze me in whatever time I got there if I felt I needed to see him before my appointment on Wednesday. Okay, it's Monday morning, day 4 after the surgery, and I see a little bit more improvement today. I could see better to do my hair. Probably doesn't look much better to you, but yeah. I can see a little more detail, a little less fuzzy. So we've decided not to go into the doctor's office this morning. I'm feeling more confident that things are progressing the way they should be now. Okay, today is day 8. On day 5, I went back to the doctor and my eyes were still very blurry. He said I have an astigmatism in that eye that should calm down within a week or so on its own, and that should take away the blurriness and the cloudiness. If it doesn't, they'll just go in and do Lasik surgery and just reshape the eye, which is a very easy thing to do. And he's not concerned. He's like, if it doesn't calm down itself, we'll fix it. No problem. He's confident that that's an easy fix. So he said, just be patient, wait a week or 2. So I go back to the doctor next Wednesday. So that would be like day 13, and we'll discuss it further by then. When I first had the surgery, like a couple days after, I was able to see close up reading my iPad, which I was very surprised at, but far away was very fuzzy. Now I'm losing the close-up vision, which is what I had expected. The far away vision, today I noticed a teeny weeny little bit of improvement. It's still blurry and a little bit foggy. So it's been a little difficult to do anything. We did get out for a bike ride yesterday, which was the first time because You have to be able to see those potholes and topes coming up on you. I'm trying to be patient and do as the doctor says and just let the eye heal and see what happens. And if it doesn't heal properly, there's a fix for it. So I'm not worried, I'm just frustrated. Okay, so here's the update. February 2nd, I went back to the doctor, which would be about a month after the surgery. Still having some issues with my eye. Hadn't seen any improvement in about 2 weeks. So we decided we're going to go ahead and do the LASIK surgery. February 10th, I had the LASIK surgery, and I'll include the video of that for all of you that want to see. My eyes were very sore right after it. It was an easy procedure, but immediately following, my eye was like burning for probably about 4 hours. They were so light sensitive as well. I just put my hat over my face for the cab ride home, came home, went right to bed, took a couple Tylenol. And honestly, within 4 hours, it was gone. There was no pain at all after that. I just stayed in bed. You're not supposed to read, watch TV, or use the eye at all, so just stayed in bed, listen to music. I woke up the next morning and I can see! Yes, amazing. So happy. The vision came right away. As soon as I opened my eyes, it's like I can see everything. I can see the light switches on the wall. I can see where the plugs go in. I could see all the detail. So that day, I went back to the doctor for a checkup, and he said, "Yeah, that's great. Everything. Now you have to give it a couple weeks to a month for the eye to completely heal. So still no swimming, no going in the ocean, no going in swimming pools or cenotes with my head underwater. But it looks like I'm in the clear and things are progressing the way they should now. So I'm totally thrilled. I have noticed that for reading, it's getting a little harder now, so I will be needing some readers. I go back to the doctor in about 2.5 weeks, and we'll see where it is then, and he'll let me know what prescription I need for my readers. But I've picked up some really cheap ones from the store, and it looks like I'm only at a 1, so I don't need much. I can still read, normal size fonts without the glasses, but anything finer or dimly lit, it's harder. So I would say it's a success. I'm happy. I went out and bought a pair of Maui Jim sunglasses because I've never been able to have really cool glasses because they were always prescription. So, yay! Thanks for coming along on this journey with me. This is where I'm going to have the LASIK surgery done. Be laying right there as they slice open my eyes. My eye, just one eye this time. So right before the surgery, they'll give you some eye drops that will freeze your eye. They'll do that a couple of times, and they'll give you a pill to help you relax. It's like an Ativan, but a different brand. Then they'll bring you in and put you on the table, and they'll put a metal clip to hold your eye open. You don't feel any of this at all. And they'll make sure that everything's positioned correctly. There's a light that you have to stare at. They tell you to make sure you keep staring at that light. And they'll clean the eye before they do anything. Then they put this metal ring on, and that's what cuts the eye to make the little flap. They're talking to you the whole time, explaining exactly what's going on, keeping you calm. Then they'll pull the little flap back, and that's when they'll be able to do the Lasik on your eye. The actual Lasik takes about 11 seconds. And at that time, you don't see anything. It's like you go blind for those 11 seconds. You do smell a little bit of burning, but no worse than when you go to a dentist and they're drilling. Then they put the flap back up, and that's when you start to see again. And they'll smooth it all down to make sure there's no, to make sure that it's completely where it should be. So they put the flap all back in place, and then they use a little brush to make sure it's all in the right spot. Flatten everything down, and it's weird because you can see this, but you don't feel it. And then you're done. Woo! Would I recommend them? Yes. They weren't happy until my sight was perfect.